All right, let's speak to Minister Joe Phaahla. He joins us live. Minister, thanks for your time. We appreciate it. So questions, of course, regarding the lifting of the national state of disaster, given that you've come up with an alternative, remains. When do you think that's going to happen?
We really just finished our proposals just about 2 days ago. We've been working on it for some time, getting legal input. We are now ready to present. We believe that the meeting should happen in the coming week once we are assured of, we've been given assurance that the meeting will sit in the coming week. So we will be ready to make our proposals to the National Coronavirus Command Council, and hopefully after that it will go to Cabinet.
All right. When are we likely to hear from the President then about the changes to the national state of disaster?
Well, once we have made the presentation and whichever aspects are accepted, then what follows, it's the legal route in terms of gazetting into the National Government Gazette, and then the legal processes. So once those decisions are made, then the President's office and the legal people will advise. We are hoping that some of the measures which which we'll be presenting, which we hope can help to relieve some of the pressure, can be implemented, in a few days' time. So that's what we are hoping. But that's basically just from the health department side in terms of the mandate which were given by Cabinet to go and work out proposals for an alternative approach to how to contain the COVID-19 pandemic.
Yeah. So let's talk about the measures a bit more, Minister, if you can. I know that you say it's going to actually assist in guiding the reopening of certain sectors, in particular leisure and tourism industries. What are we expecting to see then if we don't have the national state of disaster? And does this mean there can be more people allowed outdoors and indoors going forward?
Those are the matters which clearly, as you would know, Shahan, where we are. I mean, if you consider where we come from the lockdowns 2 years ago, the various stages, sometime when there was another wave, second, third wave, where we would come back to the risk-adjusted approach, which would sometime bring us to level 5, level 4, people not allowed to leave their homes, no movement, traveling across provincial boundaries. We've come through all those things. What we are left with now is not the rocket science. What we are left with now is the issue of wearing of masks whenever you leave home. Secondly, the issue of sanitizing, washing of hands. Thirdly, the issue of social distancing. Fourthly, the matter of gatherings. And I could also maybe add in terms of travel, the requirements in terms of what you require. So those are, I might miss something, but largely lots of the things we have done away with. In December, we did away with curfew, the issue of travel restrictions or across, all those things were left out, as we went down to level 1. So those are the 5 kind of issues which we have to address and see. What is it which is still required to assist the nation in avoiding a super spreader of the COVID, because it is still there. The COVID is still there, as I said this morning, not only in South Africa, in the world. WHO reported in just 1 week, 10 million new infections worldwide, with 60,000 deaths worldwide in 1 week. And in our own country, we're still reporting daily infections of just under 2,000, sometimes approaching very, very close, if not over 2,000, some deaths, some hospitalization. So the question is, with the 5 issues which I've mentioned, what we're then working on is which of those, with what level, needs to be sustained while the infection is still spreading. That's basically a package which we will then be proposing to the Coronavirus Council.
Okay, everybody's asking about the wearing of masks, right? That's the one irritation, it seems, for people when it comes to this virus, especially since other countries have moved away from it. Is South Africa ready to remove masks, given that our vaccination rate is at, what, 42.92% of adults fully vaccinated? Can we move away from the mask issue?
Well, you're right. You're actually asking the question of some of the things which we have grappled with, looked at proposals from even our experts. We are at a disadvantage in terms of the fact that, I mean, as I mentioned this morning, I've had 2 international meetings just this week. One which was, both of them attended by the DG of World Health Organization and other members. Now, just one yesterday, which was convened by the Secretary for Health and Human Services of the United States, where there are a number of ministers of countries. In a number of countries reported, just to give an example, I think Indonesia reported 90% vaccination. Italy reported 90%. A number of countries reported 70, 80%. So they are able to relax quite a lot of, some of them even do away with, most of the measures because they are at 80, 90, 70% coverage. So we are looking at the balance of the fact that we are still far from reaching even 60%. But at the same time, there are certain, issues in terms of the fact that the virus has spread across. There's some level of natural immunity and vaccination immunity and so on. So we will be presenting that balance to the Coronavirus Council, and we will be proposing options. But unfortunately, me and you will be able to talk better when I've got the latitude to go into detail. Yeah. Because otherwise, I'll be very guilty of saying things which I've not even presented to my principals. So, but all that I can assure you and the listeners and the viewers is that we are spot on looking at those. We will be presenting options, and just on the masks, we are aware of the fact that there are certain views about indoor, outdoor, the risk, and so on. So we're making very practical proposals.
Well, I mean, some experts in South Africa, in particular Professor Shabir Mahdi, suggests there's no need for masks because given our vaccination rate versus the immunity that we have right now in the population after a recent study, that there's no need for masks right now, especially outdoors. So are you saying to me that's also being considered? Everything's being considered when it comes to this decision going forward?
Well, we listened to a number of inputs. I mean, within our own Ministerial Advisory Committee, we get various views, but we also listen to other experts. We can't listen to one expert. We listen to a variety. I mean, as you would know, a few weeks ago, just to give you an example, the DG of WHO was here in South Africa. We spent 2 days together in Cape Town. He was also in 2 of the meetings I attended virtually this week. Dr. Michael Ryan, who's an expert at WHO, they also give us a different aspects. And if you look across nations of the world, you will find different views. So we have to look at the balance of all those views. So we will present those. All that I can tell you is that nothing is off the table. Okay. So we consider all those and we give options. There will be a decision, hopefully, before the end of next week on some of those, and then the people with the necessary authority will be able to make the announcements.
Minister, I'm talking about timelines. You said to me in our previous interview that we should have an answer on vaccine mandates by the end of Jan, I think it was. We're still waiting for that decision. What's happening in that regard?
Well, Shahan, it's a complicated and very emotive issue, as you know. There are all sorts of views and threads. If you look at the university, so we've got a team which has been doing consultation. They've finished at NADLEC. They've got a particular, also they will be also giving a report in the coming week. It's because of the complexity of that matter. But even on that matter, there will be a position taken when the meeting does take place. So my expectation is that ultimately this time that presentation together with our president, because that one is a team of a joint team of various heads of departments which have been mandated to do the consultation. They will also table some of their findings in that regard. And at this time, at least, I believe that when the meeting does take place in the coming week, there will be a decision, and that matter will also be finalized.
And obviously, you think that decision would help us in getting more people vaccinated so we could possibly remove the masks, right? So all of that has a knock-on effect, I'm guessing.
Definitely, that's what we need to balance, the fatigue amongst the people, but also the risk that if we just simply wake up and drop everything, and you know, we can just reverse all the gains of containment which we have achieved up to now. So those are the balances which all of us, I mean, I can tell you now, you know, when I sit with those, you know, other ministers from different countries and they mention 90% coverage, you really just listen with envy, because they now have the confidence that in terms of serious risk, they really don't have, and that's why they can relax many things. So we still have to balance to make sure that in the next few months, if more people, if we give some space, but still encourage that people, the measures we take, including whether you call it mandates or incentives for people to vaccinate, so that they can access certain leisure activities, recreational activities, and so on. The combination of that, we hope, can bring more people, so that hopefully the target which the WHO has set of June this year, in terms of all nations reaching 70%, we could be talking a different story if we could have a turnaround in that direction.
All right, let's move on to something you said that concerned you, and that was the infection rate among 10 to 14-year-olds. What do parents need to consider, having heard you say that?
Well, I think we do understand, as our experts from the National Institute of Communicable Disease also have explained, that largely there are a number of factors. One is the fact that we do have a subvariant of the Omicron, which they call BA.2, which seem to be also responsible for the continued, you know, even though not very high rate, but the continued sustenance of, you know, not being able to go below 5% of positivity rate, but also the fact that this coincided with the opening of schools. They're doing away with the reduction of numbers and rotation at schools. That all those actually, you know, collided and brought this, and also the fact that we have not opened up for vaccination of below 10 years. Actually, we vaccinate only up to 12 years of age. That all those factors collided in a way, you know, to give us what we're having. So what we can say is that there is not really a lot which parents need to extraordinarily do, except for the fact that if there is suspicion of, you know, symptoms, although also the experts tell us by the time, sometime when you get the symptoms, the infectiousness has already been there for a few days. But it's just caution whenever there is some indication of some symptoms amongst the children, because the biggest fear, we know that the risk in terms of serious illness amongst the children themselves, it's quite small, even though a few have been admitted to hospital. So the main fear is infecting the older people who are more at high risk with comorbidities. Okay. So it's really just to be careful when you pick up amongst children some suggestion that they may have some flu-like symptoms.
Okay. Last question, and it's something different, regarding intern doctors at the Chris Hani Baragwanath Hospital saying that they haven't been paid, and we're seeing senior doctors there actually put money together to buy them food, because that's how dire the situation is. I'm not too sure if you can actually help answer why this is happening.
Well, unfortunately, I've not been alerted to that. Okay. Because we did arrive at the solution, as you might remember, that towards the end of last year, there was a problem in terms of budgetary allocation for interns across the country. And we did work out the solution with the National Treasury. You would have heard the Minister of Finance announcing a provision, even though it's in the new budget of April. But based on that, we had reached an agreement with all the provinces in terms of, in the meantime, being able to fund. So that's a matter which I would have to take up with the MEC for Gauteng. We don't expect that kind of a problem. So I would need to check with them as to what was the problem, because that matter was addressed before December, before the end of December.
Yeah. All right. I'm going to leave it right there. According to the Gauteng Health Department, they say that too many interns were initially allocated to the hospital and that they needed to deal with a backlog. But Minister, thank you so much for your time. We appreciate it. Great speaking to you on South Africa Tonight. Health Minister Dr. Joe Phaahla.